as many years as I've done parenting, I've realized that control is kind of an illusion. We
Yes.
might have control or need to control, but the reality is that's another person who has control of their own thoughts.
I am super excited today to be talking to an expert in family systems and just child mental health as it relates to the whole family, and how do we take care of ourselves as we're raising our kids. So let's just start with, if you could introduce yourself professionally.
Okay. My name is Laura Olson. I own an agency in Colorado Springs called Palomé Child and Family Specialists, and we do provide a lot of different services for families. We work with kids, we work with adolescents, we work with parents, we work with grandparents sometimes, just on services that help keep families together and help strengthen families.
Yeah. So I'm going to go from two extremes, and like a kid is suicidal, they go to an inpatient hospital. When they come out, they're referred to your intensive outpatient. How do you start with a kid who is kind of in that kind of crisis?
Well, first thing we start with is an assessment and try and get a full idea of what everyone in the family is experiencing, just because we may have an identified client or patient, but we know that what that client is experiencing, the whole family is experiencing. So we try and get an idea of what supports that family might need and what supports that child might need.
So talk to us a little bit about that, because I can tell you, I raised 7 kids, 5 of which were adopted from the foster care system, 2 with pretty significant PTSD, reactive attachment, lots of things going on. And as a parent, sometimes going into the mental health, putting your child into the mental health system feels judgmental, feels like I'm not a good parent, I've done something wrong. Talk to me about just family systems and how we can come together as a professional organization, but also as a community, so that parents don't feel like that.
Well, I think the first thing I always say to parents is that there's not a such thing as a perfect parent. We've all had challenges as parents, and our children are our most precious, the most precious thing to us. And so when something happens with them, it's very scary and it's traumatic for us. And so that in turn affects kind of how we relate to them and we relate to the world. So it's not so much a matter of right or wrong, it's a matter of how do we get this system running smoothly again that's been traumatized, because the entire system's been traumatized, not just the child.
And system, you mean family system?
The entire family.
Yeah.
So.
And talk to us a little bit about what that trauma does maybe to siblings and parents, and is it different with moms and dads?
Well, I think it depends on the dynamics, but sometimes siblings are kind of feel forgotten or lost. Maybe they are. I know I experienced this with my family when I had one child who was doing a lot of acting out. The other one was kind of like, yeah, you put me over here. And I didn't say anything because I knew you were busy with him, but, so, I think with siblings, they either are acting out to get some attention or they're kind of hiding in the shadows, kind of staying out of the way kind of thing. And so that creates trauma for them, and they don't always tell you that. I think it depends on the parent, but I know both parents, you care about your kids, and there's that emotional attachment, and that makes things more reactionary. And it's why it's different for me to work with your child than it is for you to work with your child. And even as a clinician, I saw that with my kids, and so I'd be like, "What? I'm teaching people how to parent, and I'm struggling with my own kids." So
that's what I say in my Raising Mentally Strong Kids curriculum. It's like, here's all the mistakes I made, and I had to go back to my adult children and apologize for certain things I wish we knew those things as we were raising our kids. And I think the biggest thing that I teach is, like, when you're reacting to your child's reaction, it's actually in you. It's a button inside of you that you should try to figure out.
Probably from your child.
Probably from your childhood, rather than thinking it's always the child's behavior. Yeah.
Well, and the child's behavior is sometimes traumatic for you because they're doing things that are scary and sometimes in your face or aggressive, or you're afraid they're going to hurt themselves. And so that fear kicks in as a parent, and you're like, how do I help my child?
And do you mind sharing, you talked a little bit about personally having to go through it as a parent, and I think that would resonate with the audience of like, just because we have initials behind our name doesn't mean we don't have children, with mental health concerns. And, what was that like, and how did you work through that?
I think that emotional connection that you have with your child kind of ups the ante a little bit, if you want to say that. And it's, when I'm working with someone else's family, I don't have that emotional connection. I mean, obviously I care and I want to help them, but at the same time, I don't have that bond that a family member has. And I often talk about my experiences with my kids when I'm working with families on parenting, just again, because I made mistakes. Now I go back and I talk with my kids, and they'll tell me something that I saw one way, and then they'll tell me something and it's a completely different perspective that I hadn't even thought of, and I'm like, oh, well, I can see how that might have been traumatic for you. For example, I know my daughter talked about we'd always send her to her room so she was safe when her brother would get escalated, and she'd say, well, you'd send me there to be all by myself, and I just sat there and was scared and stressed out, and no one was there with me, and I'm like, I thought I was keeping you safe. So, just examples like that. As a parent, we do what we know until we learn more, until we do better. And there's a quote from Maya Angelou. I can't quite think of the exact quote, but it's basically, we do what we know until we know better, and then we do better. And that's how parenting is.
It's to learn as you go.
You do. You learn as you go, and you learn from your own parents and your own experiences, and depending on what those were, sometimes you're kind of on your own. And so, again, we learn as we go, and you get to decide what you want to do with the information you get. So,
this is a little bit off topic, but I think this is something that a lot of parents struggle with, is my child manipulating, using these mental health words to control me? How do I set limits with that, but obviously not ignore mental health concerns?
I think that's a difficult thing. I think the hard part is manipulation can come out of trauma. It can be a learned behavior, and it could have been the only way that a child has kind of gotten through a situation. So it may be something that they've learned to do to try and get their needs met. And so, we want to be aware of the potential manipulation, but also really look at what need are they trying to get met here? What's going on here? Because chances are there's something that they need some help with.
Yeah.
And so we want to figure out what is going on here.
And let's talk about like managing those expectations and time that it takes to address mental health concerns, because I think the frustration comes when we can't fix them. Bring the child to a mental health professional, and somebody's got to fix this because I have to go to work, or there's other environmental and psychosocial stressors on that parent. And I know you have lots of programs to support some of that, but let's just talk about the initial time expectation and work that has to be done in family work.
Well, I think the first thing that has to happen is you have to develop a relationship with someone, and depending on experience, that can take a while. I mean, it just depends on what experience they've had with other people, the system, professionals, and whether or not they feel like they can trust you. So, I mean, and that can take a couple months, it can take 6 months. It just kind of depends on their history. But I think another hard thing that a lot of parents don't realize coming into mental health treatment is that it tends to get worse before it gets better. Because you're bringing them in, you're developing that relationship, and then you start stirring things up, and stirring up either trauma or negative experiences and things like that. And so you might get some acting out behavior or some things happening as they're processing through all of that. So it's not a short process. It's not something that happens overnight.
And I love that you said that it could and very likely does get worse before it gets better, which is scary for parents.
Yes, because what our brain knows is normal. When we're trying to make a change and create new connections in the brain, what happens is it tries to go back to what it knows. So, and you have to be consciously aware of those changes you're trying to make, because our brain goes back to what it knows. And so, when you've got children who are trying to change behaviors, then it's gonna take some time and some repetition, and for it to internalize and to kind of build those new connections in the brain, which takes time, like weeks
And what kind of
weeks.
work does the parent need to do?
Well, I think that the parent has to look at how their child's behavior is affecting them, how it is pulling out triggers and buttons from their own childhood, maybe their own attachment style, things like that, but really kind of looking at how is this affecting them as a parent and as a person, because that's going to unconsciously sometimes affect how we react to our kids and how we interact with them. So, and again, it's not about right or wrong, it's just about how has the system kind of been shifted, and we've got to figure out how to get it back in the right groove, and that takes everybody.
Yeah. And how, I'm thinking of two scenarios in my mind. One where the parents are adamant that we're going to not change the way that we're doing things, and situations where you have one parent willing and wanting and one parent who is adamant that they're not going to change.
Yeah.
And how, both are difficult situations. How do you guys continue to support the child when there is that resistance?
Well, I think when you're supporting the child, I think the consistency is key, and making sure that you are creating a safe space for them to process through their experiences and have new experiences that are going to help them. It's definitely very challenging when you don't have everybody on board. I mean, I know from experience just in parenting kids in general, if myself and my husband were not on the same page, that opened up lots of opportunity for manipulation and triangulation and all of those fun kinds of things. So,
and fighting within that relationship,
Right.
so then the mental health of the child is impacting your intimate relationship as
so
well.
yeah, so then you, as a couple, you're fighting and you're struggling, and so again, that's why to me it's a system, and it's when one part of the system is not functioning or struggling or having some challenges, it's going to affect the entire system.
Yeah. Is insurance paying for family counseling?
Depends on insurance, but there's a lot of resources out there that will, most insurance will pay for like therapy, individual and family therapy, and some group therapy, but some of the more intensive stuff like in-home services and things like that, Medicaid will cover, or CHB Plus, but there's just some other resources that we try and access to get funding.
Yeah.
So all families can benefit from it.
Okay. So if someone came to you, kind of on if there were a mild to severe, we talked about the severe case of someone being suicidal, and obviously that's very urgent. But you have a fairly functioning family. A child is showing signs of kind of some depression and anxiety, and they reached out to you. What are some of the first things that you work on with?
Well, I think the first thing, again, like I said, is we do an assessment and really kind of look at the whole family and at a trauma history, if there's any kind of trauma there, and kind of expand that idea of trauma, because a lot of people think that means abuse or neglect, but there's so many different things that can create trauma to the developing brain that it's much more than just something like intentional all the time. So, and then get them into some type of individual therapy or even advocacy or mentorship, just kind of start getting to know the family. We have a couple different parenting class options. One of them is kind of more of a support group, I think. There's some education in there related to kids with trauma, but it also is a support group for parents who are not sure how to handle what's happening with their child, and so they're able to talk to other parents about, realize they're not the only one dealing with this, because it can be scary and isolating. So I always encourage parents to either engage in that parenting support group or some type of in-home service if they're willing to. I mean, it just kind of depends on what their needs are.
Right. Tell me about the parenting class. What is included in that?
Well,
the curriculum?
We do, I use a lot of Nurturing Parenting Program, which is an evidence-based parenting class that has different levels of intervention, I guess you could say. And the other one I use a lot of is Trust-Based Relational Intervention, which is TBRI. I'm a TBRI practitioner. And this is really looking at how kids who've had early childhood trauma or even adolescent trauma, how it can change the development of the brain and create some of these behaviors that we're seeing, or trigger some of these behaviors that we're seeing. Because I think a lot of that is helping parents to understand where it's coming from, and that it's not necessarily them, it's something else, and that it's easier to have some empathy sometimes for that behavior when you know a little bit about where it's coming from.
Yeah,
so,
for sure.
I mean, and that's even prenatal trauma, birth trauma, medical trauma. I mean, there's a lot of different ways that...
We have a lot of patients here with adopted, their child is adopted. And I too, went through this of thinking, oh, you just adopt them and love them and you can reverse this trauma. Right. And I learned the hard way that it's a lifetime of trying to pour your love out, and especially in reactive attachment where there's kind of an actual attack to your love and trying to sever that. What would you say to adoptive parents as they're, trying to be this stability, but oftentimes need to set, limitations for their own sanity?
There's a lot there. I think, and TBRI itself was originally designed for parents who've adopted kids.
Okay.
That's where most of the research started, was looking at, disrupted adoptions and foster parents that were like, or adoptive parents that were like, I don't know what to do with this child that I adopted. I think telling parents that it's more than just about, it's more than just about right or wrong. It's about helping parents to understand how that a brain could have been affected through the trauma that they experienced. Even if you bring them home from the hospital, there's still a bond that has been broken, and that is still an attachment that has been severed for that infant. And so the more we learn about attachment theory and
talk about that
brain
a little
development.
bit. Yeah, attachment theory. And we'll get back to the adopted versus, because I feel like sometimes adopted parents feel like, well, I didn't create the trauma, so it's not my fault, right? But then parents who have a child who is struggling and it is their biological child and they did everything right, then they swallow too much guilt, right? Like the opposite end of that, of like blaming yourself. And mental health is so complicated, it's not.
I think the reality is that these child's behaviors can be scary and upsetting and traumatic for us as parents, and so that automatically is going to start changing the way we're reacting to them. If I'm more cautious around, or I'm walking on eggshells around this child, that's going to send a different message to this child than if, I've got this unconditional love. I may still have that unconditional love, but I'm scared of them sometimes. And so again, it's not fault. It's that fear is something that child can sense, maybe not consciously, but so we really look at breaking down that behavior and breaking down what's happening in all of those situations, and how sometimes our reactions can be escalating it without us even knowing it.
I think we get into a fight or flight.
Yes,
like I've got to control my child's behavior, or I've got to put up a boundary and not deal with it. And the healthiest thing is somewhere in between.
Right. Well, the reality is it's hard. It's hard to parent kids who have trauma. It really is. Their emotional age is not the same age as their chronological age, and so you may have a 12-year-old and chronologically, and you're dealing with a 1-year-old emotionally. So there's so many things that go into it. And that attachment is a big piece of it, because if they can't create that attachment bond as a infant or toddler, then they're kind of stuck there, and their social emotional development is kind of stalled at that point, because attachment process is what creates our capacity for self-regulation, for having a positive self-worth and how we feel about each other or ourselves. There's so much that goes into that attachment process, and when that's disrupted, it kind of...
So talk to us about prevention. I hear you saying attachment is a huge prevention strategy, whether adopted or, your biological children. The way I say it is relationships are priority. Like if you have a good relationship with your child, the two of you will get through whatever it is, right? But explain that a little more from your perspective of kind of prevention.
Well, I think, honestly, relationship is the most important thing to help get you through parenting and life experiences, because as many years as I've done parenting, I've realized that control is kind of an illusion. I think we
Yes.
might have control or need to control, but the reality is that's another person who has control of their own thoughts, emotions, and behaviors. And so
That's so hard for us, because when I was raising my kids, and I was already a psych nurse practitioner, but I read like James Dobson books, and if you just do this, your children will grow up and be these great Christians, and that's not at all the reality that I lived, right?
Right. Well, yeah.
And I don't, and now I kind of teach the opposite. That it's really about relationship, and it's not about whether you punish or not punish, or what kind of behavior modifications you use in your family system.
Right.
It's about relationship.
Right. And with TBRI, the focus is more on connecting and going back and healing that attachment process than correcting. Not that you don't correct behavior or, try and change some behaviors, but at the same time, that relationship and that connection is the most important piece there. That capacity for trust and being able to trust another person is another piece that's damaged without attachment.
Yeah.
So,
And are you still working with like families in the court system, and are doing like reunification type counseling and stuff like that?
we do some of that. Yeah, we work with families who are involved with child welfare, or they're involved with the courts because of a youth out of control youth, as they call it. But we kind of work with people from all over at this point.
Yeah. Yeah.
But usually we work with a lot of trauma, a lot of kids with trauma.
Yeah.
And then families with trauma, because again, those behaviors can be so scary.
Yeah, and unfortunately it seems to happen in family systems, generational things just keep happening in the same families.
Yeah, well, you grow up, what you grow up with is what you know, and until you kind of go out there and learn about other things in the world, you kind of do what you know. So,
yeah. So your kids are grown? Are you?
They are. They're in their 20s. So.
Okay. So as a parent of grown children, I am too, what are some things that you would have done differently? Like, to parents watching that are just, trying to do the right thing, maybe have some mental health things going on or don't.
I think I would say slow down and just kind of enjoy it and cherish those moments, because they go fast. One of the things I'm telling my son right now, who has a 1-year-old and is at that point where he's like, I can't believe it's already 1, and how fast that happens.
Yeah. Well, I love what you said earlier, and I'm going to steal it, is control is an illusion. Like, so many parenting books out there have some sort of technique to try to control. But it really, not that some of those things are not good. You have to have systems that work for your family, right? I'm not saying,
Yes.
Not saying, we do free range parenting is for everybody, but doing that with grace and relationship, I think, was what I got from that.
Well, and I think what we have as a parent through relationship is influence. We don't have control, we have influence. And the stronger that relationship can be, and the more consistent and safe that relationship can be, the more influence we have over that child.
Right.
Because at some point they're going to get up and walk out that door and be able and go make their own choices. And even if you've ever tried to put a toddler to sleep that's not tired, that you really don't have control. You have influence.
Right.
So
you have influence, you don't have control.
And ultimately, we want to teach our kids that when they go out in the world, they have to own their own behaviors and their own choices and their own thoughts, and nobody else has control of those. That they get to decide what they're going to do with it. They may be angry about something, but what are you going to do with that? Because nobody else can. If you say that person did it and that it's all that person's fault, well, then you just gave all your control away.
Yeah.
So.
Love it. All right. Well, let's end with just kind of how people contact your organization, what actual services and that you provide, so that we can get some referrals and start this great collaboration between us.
Okay. Well, so the organization name is Palomé. It's Palome. I know a lot of people say Palomé.
That's why I wanted you to say it.
But that's what you get for making up a word when you start your own business, right? I don't know if the phone number.
Well, we'll put like the contact info in the website down, just kind of what services you provide, what that looks like.
So we provide everything, individual therapy, we have group therapy, we have family therapy, we do in-home services. A lot of times you hear family preservation, but it's basically intensive in-home services to support the entire family. We have different parenting classes, advocacy and mentorship for adolescents and youth. We have an intensive outpatient program for youth.
Do you have something for littles, like 6, 7, 8 years old?
Yeah, our intensive outpatient program, we have one for school age and we have one for adolescents. And then under 6 or 7 years old, they would probably be more like family preservation or play therapy with kids.
Yeah, we see a lot of that attachment issues in adopted children, even as young as 4, 5, 6.
So a lot of times we're working on that attachment, but that TBRI I think is a big support for a lot of parents getting into that group, because one, they get some education, but some nights we're just sitting there brainstorming about a situation that one family has. Yeah. And they're like, I don't know what to do with this behavior. And so we sit there and think, okay, where could it be coming from? What are some things you've tried? And we just kind of break it down. So I always call it a support/education.
Yeah. Well, and I love the way you say it is, yes, it could be a behavior, but what are they trying to gain from that? What are they missing that they feel like they have to?
What is the need they're trying to get met? Yeah.
Love that.
So I'm probably forgetting something.
Yeah. Well, as a professional, if we refer to you, you do the assessment and we'll put them in what programs they need.
Yeah, we'll make recommendations, even whether it's here at our agency or another agency. We'll make recommendations. We provide a lot of things, but we don't do everything. So we have a lot of good relationships with other programs, and we even we do some services up in Woodland Park as well, and have a teen center that we're supporting up there. I'm hopefully going to be starting one here in Fountain soon. Okay. With the Edge Teen Center is a nonprofit, so so we go out and provide mental health services to kids at the teen centers. So
and these are just like walk-in centers?
They are. What they would do if you go into the centers, they would do a quick intake and kind of get an idea of what's going on in your family, and they're mental health based, so they're doing more structured activities than it's not just going to go in and sit around and hang out kind of thing. We're doing things that are going to support mental health.
And is this billed through insurance, or do parents have to pay for that service?
It's usually billed through insurance. There's some self-pay, but we usually try and find some resource out there to help support the services.
Well, the website and contact information will be in the description. We are looking forward to having a great referral-based relationship with you guys. You do everything that we do not. So very happy about that. Thank you so much for coming today.
Thanks for having me.
Yeah.